of a global leadership program, which is called Aspire Global Leaders. And this is a young doctor movement initiative by World Organization of Family Doctors, WOMCA. And I'm working with 7 regions across the world to develop the leadership skills of the young doctors. Thank you for joining us in this webinar.
Hi, and good afternoon. I'm Erin Sullivan. I'm the research director at the Center for Primary Care at Harvard Medical School, and I'm also a faculty member here at the center and in the Department of Global Health and Social Medicine. I lead our center's efforts to train frontline primary care physicians and train students, residents, and attending physicians in leadership skills. Thank you all for joining us today. Really looking forward to hearing from you and hearing your questions.
So I'm going to start the presentation. So today, Erin and I will talk about some core elements in becoming a leader in primary care. And as we said, this is a program, this is a webinar, which is organized by Aspire Global Leaders Program, Harvard Medical School Center for Primary Care, and Mission Rescue. So today, we are going to talk about, in the first part of the webinar, defining characteristics of a leader. And this will be followed with an activity on understanding your own beliefs and values as a leader. And in the second part of the webinar, we are going to discuss setting a vision, and during which we will have an activity on creating your personal vision statement and setting a vision for the teams and the organizations. So the question is, why do we care about leadership in primary care today? Because with the demographic transition today, the elderly population makes a big proportion of the consultations in primary care. And they live longer, and mostly with a long-term condition and a couple of comorbidities. Following this, in the last years, we see an increased number of non-communicable diseases across the world. And these conditions make a proportion of primary care consultations, as I said. And it's usually difficult and complex to manage these patients and take so much time in the practices. So today, more and more we see primary care professionals tend to work in group practices and work as a team and share tasks across the team members to manage these complex cases in primary care. And considering all of this, leadership and teamwork have gained more importance in primary care in recent years. So in April 2018, researchers from Harvard Medical School published a paper called 5 Keys to Leading Transformational Change in Primary Care. So in their paper, Hunt and Elner talk about 5 strategies that were pivotal in managing a complex change process in a primary care center. This project was a 4-year team approach project within residency training practices and community health centers in primary care settings. And it was composed of in-person learning sessions, monthly webinars, practice coaching, and leadership engagement. In the end of this 4 years project, they made an evaluation and they saw that the outpatient visits, emergency room use, and total hospitalizations were decreased, and the staff perception of team performance were improved. So in the paper, 5 strategies that were identified were evidence-based change concepts and tools. And this was important because we know that healthcare providers usually rely on scientific evidence to guide their actions in the practice. The second point was fostering strong relationships within and across practices. This was an important link with other like-minded practices, and it was important to share their experiences across the practices to isolate and remove the monotony of primary care. In the third part, simple system for reflection and feedback, the researchers asked the practice team to present monthly progress reports and some assignments. This included aim statement and the actions taken towards this aim and the challenges for which leadership was needed. This increased the communication and setting the direction for the future processes in the primary care settings. The third key point was structured time for team discussion and planning. This was a challenge in the beginning due to patient overload and the time management problem. But later on, the teams took time to have a meeting in the mornings before the patient consultations. And they discussed improvement efforts emerging challenges in the practices, and other issues that require attention. And lastly, regular and meaningful engagement of leaders. This found to be a key element from the beginning. And for instance, one of the most important activities was the leaders present their aims and the 3-month plan to the practice teams. And this made an opportunity for the practice team to talk about the challenges in the practice and also discuss the possible solutions with the rest of the team. So today, in the literature, we see a number of activities and key competencies of managers and leaders. And we know that we both need managers and leaders. But as a focus of this webinar, we are going to talk about leadership. We know that the objective of the leadership is leading people, and therefore it requires followers. And the leader motivates through inspiration and needs a vision. And by using this vision, a leader sets direction. Another important factor for leadership is values and beliefs. Personal values and beliefs serve as guiding principles to leadership behavior. Therefore, leaders should be aware of their core values and beliefs to be effective clinical leaders, which we will talk in a few minutes. So in this part of the webinar, we would like to invite you for a little exercise. Maybe we can ask Diana to spread these exercises in PDF format after the webinar, but I will just make you walk through with me through the steps of this exercise. In the first part, we invite you to think about the primary care leader who has inspired you and list the values of these leaders that the person has demonstrated. Following this, in the second part, we invite you to list your own values and matching with the leader's values, seeing the duplications and the differences between these two lists. These values could be honesty, transparency, empathy, or any other that comes to your mind. And after that, we invite you to think about your own beliefs. For example, a belief statement could be, each of us may see things differently, or each of us has different competencies, and that makes us an effective team when we come together. So in the end of this exercise, we invite you to write down a summary statement of your values and beliefs as a leader. This is important because we know that this will be the beginning point of your leadership as an effective clinical leader in primary care. If you follow TED Talks, maybe you know Simon Sinek, who gives many talks about leadership. And in one of his talks in 2015, he talks about build your life with your values. And in this TED Talk, he says that articulating our values as verbs gives us a clear idea. We have a clear idea of how to act in any situation. Therefore, the statement of values and beliefs will give you an idea about how to act in any situation that you face in your primary care settings. So once we talk about the values and beliefs, here comes the question of clinical leadership in primary care. Today, it is known that for sustaining cultures that ensure high quality, compassionate care for patients, we need teamwork. An important contributor to healthcare quality is the 5 key factors. These key factors are team working, inspiring visions, operationalized at every level, and clear, aligned objectives for all teams, departments, and individual staff, supportive and enabling people management, and most importantly, staff engagement. And lastly, learning, innovation, and quality improvement embedded in the practice of et al. In his paper, West et al. Talks about leaders, and he says that leaders must ensure that healthcare staff work together across professional boundaries to deliver high-quality care, particularly as the complexity of healthcare increases and the comorbidity becomes more common. So, in the last part, some key elements that an effective leader should have: to be accountable and transparent in decision making, and to be open to other people's point of view, to be visionary, and capable of communicating the vision and motivating others towards this vision. So this is the end of the first part of the webinar. I'd like to thank you for your attention, and I leave the word to Erin to continue in the second part.
Great, thank you so much. Let's move to the next slide. So I'm going to spend the second part of the webinar talking about specifically one of the key skills that leaders need to have, which is the ability to set a vision, which actually beautifully was referenced in each of the last two slides. So we're going to do a deeper dive into that. What I want to start with, though, before we head into vision is just talk a little bit about leadership and what it is and how it differs from management. One of our earlier slides listed the competencies of management and leadership, and just maybe a 30-second sidebar here to say that there's a difference between managers and leaders. Organizations need both. Managers tend to be more preoccupied with the day-to-day operations of a clinic or a practice and delivering high-quality care reliably over and over and over again. Whereas I think of leaders, and the management literature thinks as leaders as focusing on the bigger picture of taking organizations into the future, of vision setting, of empowering and engaging everyone within the organization. And that sort of, if you're thinking about the difference between managers and leaders, you know, managers day-to-day operations delivering high quality clinical care, and leaders really thinking about the future and where are we headed and where is care delivery headed. So I just wanted to make that distinction to make sure we're all on the same page. Quick definition of leadership is on this slide. I tend to work with 3 different definitions of leadership when people ask me about what is a leader. One of the really basic definitions is people have to be willing to follow you. You can't be a leader without followers. The other definition I tend to work with is a leader is someone who's empowering others and those around them. And then the third definition, which I borrow from some of the classic management literature, is really about that piece of a leader taking an organization into the future of finding opportunities that might be appearing. In this day and age, opportunities tend to appear faster and faster as the pace of change is quite rapid. And leaders really worry about that vision, about getting people's buy-in, about empowerment, and most of all, I think leaders worry a lot about producing useful change and helping their organizations cope with change. I don't think leadership is about attributes; it's more about behavior. And I think the real difference with some leadership training programs is, you can attend webinars like this and get a lot of content knowledge, but what actually makes you a leader is taking that knowledge and putting it into action. Next slide, please. So we're going to start going down the road of the vision piece and how leaders set vision and why that's important. And this is a quote from Henry Mintzberg, who is a management theorist. And in 1992, in a paper called Cycles of Organizational Change, he defines that one of the main roles of a leader is to engage the team in the vision for change. So, engaging the team involves things like buy-in and empowerment and moving people forward. And you need to have a vision to actually engage the team in. They need to know where they're headed in the future. Next slide. So what's a vision? One thing I would say about a vision is that a good vision, some people think visions have to be brand new and innovative and things people have never seen before. But a good vision actually doesn't have to be innovative, and most visions are not. We're going to take a look at visions and a couple of example visions in a minute. But most visions usually consist of an idea that's already fairly well known. It's an attempt to articulate what a desired future for an organization would look like. This is the big, big picture. This is seeing the forest, not the trees. And your vision will typically serve the interests of important constituents. Those important constituents in healthcare and in primary care in particular tend to be patients, leaders or administrators of a bigger health system, ministries of health, the community that healthcare or clinics and practices are based in. And then finally, I would say vision should help guide behavior, right? So as a leader setting a vision for an organization, what you want is for the vision you set to help people make choices about behaviors and decisions for their, their own part of the world that's going to move the organization forward. Next slide. So one thing you don't want to do is you don't want to confuse a vision and a mission. I think mission statement is very much that present day statement. That's what we think about in management. Is a mission statement describes what a company wants to do now. And a vision statement is about what a company or an organization wants to do in the future. And to sort of help clarify this, we're going to look at two example vision statements. Next slide. On the next slide, that gives you a sense of mission versus vision. And these come from two organizations that I've had the privilege of working with and studying with here in the United States. The first one says Central Foundation, which is actually across the country in Alaska. And their vision, or their mission statement rather, what they're working on now is working together with the Native community to achieve wellness through health and related services. Now you will see their mission and their vision are actually pretty solidly connected. The spirit of it is similar, but what they would like to, what they see 5, 10, 20 years down the road is they would like to have a Native community that enjoys physical, mental, emotional, and spiritual wellness. So they're really focused as an organization on wellness and achieving wellness and having a community that is well into the future. They're clearly not focused on sick care or illness care, both in present day and in the future. The other organization is an organization called the Camden Coalition on the East Coast of the United States, south of New York City and New Jersey. And at the time of probably about a year ago, they revised their mission statement. They were doing a lot of care for complex patients. And they decided that at the present moment, their mission needed to be to spark a field and a movement uniting communities of caregivers in Camden and across the country to improve the well-being of individuals with complex health and social needs. So they decided that that was their mission statement, and they became actually a hub for complex care and complex health and social needs for our country. And their vision into the future is actually not just complex health and social needs, but to transform the entire healthcare system. To transfer the healthcare system so everyone's receiving whole person care rooted in authentic healing relations. So that's where they're headed from where they are now, which is focused on complex care, to moving into the future and transforming the entire health system. Next slide. So just to add another sort of component to this mission, strategy, vision discussion, because people often start to talk about strategy when you're talking about mission and vision. You know, we've gone over mission. It's about the present. It's about why the organization exists today. We've looked at vision, which is about where's the organization going in the future? What's that aspiration years from now? And in the middle is actually strategy. Strategy I think of as the how is the organization going to deliver on the mission as stated in the present day, and how is that actually going to help you shift and move towards the future. So in the how is the organization making choices, deciding on projects, reorganizing care to execute on a mission, how is that also moving you towards where you aspire to be in 5 years? So strategy is the how that tends to bridge actually mission and vision. Next slide. So this comes from the management literature about vision, and these are the qualities actually of what they consider an excellent operationalizable vision. A vision has to be memorable. So one thing that I often tell folks when they're thinking about vision is you can write it on a Post-it note. You can write it on a square of paper. It's not really long. People can remember it and internalize it. You want a vision to be exciting and inspiring. You want people to get up and come into your organization every day and know what they're working towards today for the mission, and then also for the future. Like, what is the future state? Why are they getting up and coming to work every morning? It should be challenging. While your vision might not be, innovative or earth-shattering, it should be challenging. It should be something that you are working towards achieving. If it's something that you could do today, it's not challenging enough to be a vision. They tend to be excellence-centered, so focused on things in healthcare, in particular in high-quality care. I think South Central's around wellness and all types of wellness for their people is an excellence-centered vision. The vision tends to be stable but flexible. I think one of the things leaders can do that can be really confusing for organizational members or team members is switch the vision like 5 or 6 times in a very short amount of time, or have 5 or 6 visions that they're talking about. The vision should really be stable but flexible to sort of allow for changes in the overall environment. But you don't want to be switching up your vision or talking about 3 different visions, because then it's hard for people to rally behind a vision. We're going to talk a little bit about creating a vision in a minute. And then you want it to be implementable and tangible. So it has to be something that you actually can deliver on. You can actually do something. You can get your head around it. So going back to that South Central vision with spiritual, emotional, physical, and mental wellness, that's actually pretty tangible. You can think within a healthcare system, and particularly within their system, how they have built it and how they can continue to build it to serve those aspects of wellness for their population. And then it has to be, this goes back to sort of the memorable and the keeping the vision the size of a Post-it, clear, concise, and easily understandable. It has to be something people can understand fairly easily that does not require a lot of explanation. Sometimes I think here, the simpler, the better. Next slide. So vision does affect teams and organizations, and I think I hinted at this in our last slide when I talked about leaders who have multiple visions or can't decide on a vision. It does affect teams and organizations. For some people, it really does impact why they get out of bed every morning and come to work. So it does impact, vision does impact the commitment of your team members. It does create energy amongst people and within your organization. It helps create meaning for people's work. And one of the things that is often talked about in the management research is after salary, the thing that people most want that keeps them motivated and engaged is meaning in their work. A vision also establishes that standard for excellence and for your organization of what you're shooting for, what your aims are. And it bridges your present and your future, right? You know where you are today, you know what you're trying to do, who you're trying to serve, and you also know how you can use that strategy to get from your present to your future, which we talked about a little bit earlier. Next slide. So there's 2 different ways to set an organizational vision that I'm going to talk about. There's many, many ways, but here are 2 of the most common ones that we see. There's that top-down approach where the vision is going to come from the top, or the 3, 4, 5 leaders at the top who are going to sit down and set a vision and communicate it to the organization. I think a lot of Apple Computer, when Steve Jobs was the CEO, I think a lot of the vision for that organization was coming from him at the top, and maybe a handful of his closest advisors. But I would think that his, and it has been written about, that his was a very top-down approach to vision setting. And I think the challenge for that is that you have to be able to articulate your vision and inspire others to embrace your vision so that they can make it happen, which sometimes involves communicating it over and over and over again. People need to hear things generally more than once. The other thing you can do in terms of setting an organizational vision is go a bottom-up approach. So come up with a process and a way of having your entire team engaged for setting the vision for your organization or for your clinic. We did something similar to a bottom-up approach in my own organization last year, in which we had a half-a-day retreat, and we asked everyone to draw what they thought the future of primary care would be, and brought all those sort of pictures onto a wall and use them to help inspire a vision conversation and a revised vision for our center, as well as a revised brand. So the challenge with a bottom-up approach is trying to engage everyone. And you have to remember, not everyone has that future mindset or is skilled at visionary thinking. But sometimes you will generate more buy-in from the team with a bottom-up approach. Next slide. So I want to just give you, and if you have a scrap of paper nearby or as you're listening to this webinar, this is sort of our final activity or set of thoughts before questions and answers. And what I want to do is, if you have a piece of paper nearby, I'm going to just walk you through a brief vision setting exercise. And you can do this for yourself as a leader, for what your personal vision is. You can do this for what your vision for your team is, or you can do this for what your organization is. But one of the ways of setting a vision is to think about, and we talked about this earlier in the webinar, what are your core values? So what are your core values? What are your organization's core values, those guiding principles for your organization? And what are your core values and your core purpose? So what's the most fundamental reason for your organization or your clinic to exist? And when you combine those two things, values and fundamental reason for being, you really come up with your core, what is your core, what they call your core ideology. So I'm going to give like 30 seconds here, just if you want to jot some notes down on what your core ideology is, and then we'll go on to step 2. All right, next slide. So step 2 is to think about what is your, depending on what level you want to think about this at, your team or your organization, what's your big audacious goal? What's your lofty goal, your dream for where you, your team, or your organization will be in 5 years' time? And write that down. This does not need to be fancy, and what I often find is sometimes when people don't spend a lot of time thinking about things, they really do get to the core of what they're thinking with their gut reaction. So 30 seconds, write down your big audacious goal for yourself, your team, or your organization, whichever level you prefer. All right, and those two pieces of information, your core values, your core purpose, and your goals, start to form the essence of a vision statement for, and like I said, you can do this at any level, you, your team, or your organization. Those two pieces, if you don't have a vision statement, should start to help you form the essence of a 1 or 2 sentence vision statement. And we will also include this exercise along with the one we did in the first half of the webinar in some follow-up materials in case you want this exercise to keep working on. Next slide. I think before we go to Q&A, we just also want to invite you to the pre-conference that we will be hosting. Chandan and I will be hosting with the European Forum for Primary Care at their annual conference. We're going to do a half-day session on building engaged teams in primary care. And we're going to cover 3 distinct topics: team building, motivating others, and challenging conversations. What I would say is we are very focused on being interactive. There will not be much lecture in these 4 or 5 hours. We are going to focus on giving you actual skills and tools that you will be able to bring back to your practice the following week to address your current challenges. Chandan, I don't know if you want to add anything in on the pre-conference before we go to Q&A.
I think it's a very important point, and you described very well, actually. But I just want to say that we all need to work in teams today in primary care centers. And in this pre-conference, we aim to give you the skills that you can use in primary care settings or for your own self-leadership. And when you walk out of this pre-conference, you'll be able to change some things in your own life or in your teams or in your organizations.
Great. And I think with that, we are open to questions and answers. We wanted to leave plenty of time for conversation.
Yes, I think so. Dana?
Yes, I'm trying to check in the chat. I don't know, Elena Peteros, do you want to intervene or say something? Maybe it's interesting.
Not to intervene. Two things. First of all, thanks for the very simple but very nice leadership session. Because of my background, which is both industry and academia and much less actual practice, I've had a lot of exposure on leadership trainings from Thunderbird to Hopkins to industry, and normally there is not much practical sense in linking mission to vision and or thinking in terms of behavior change. So I thought this was very nice and practical. We don't see it enough even in trainings that last days. So thanks about that. What I would like to ask is there is a lot of discussion in particular settings on how potentially a mission statement, you made a nice comment saying you need to have people knowing why they will come to work. There's some work by Prince and De Smit and De Kramer of a few years ago linking value mission statements in terms of meta-analysis and how it links to performance of people. So my question would be, what happens, because we see this in Greece and not only, what happens if you have very divergent values in your team, even under, if you like, political upheaval or in the context of a reform? So what do you do, or how would you go about matching your own values, if you like, to those of the wider setting? Because you may well have a team which is aligned, but not a wider organizational setting which is aligned, or you may have a team which comes from different backgrounds and has adopted different value systems. So what would you do then? So that's my question.
That's a great question. Tianan, do you want to take it or do you want me to take it?
I can take it, Erin.
Okay, thanks. So I think this is a great question, and I think it's very real organizationally in terms of an organization might have one sort of mission and vision, and there might be pockets or sub-teams that have different organization or different sort of missions and visions, and or you might have members on your team that are not completely aligned or have different values. So I think you're pointing out what is a very real organizational struggle, which is sometimes there's a lack of alignment between the individual, the team, and the organization. And this can happen sort of at any time, at any level in terms of value, mission, and vision. I think on the individual level, and you know, as someone who's a hiring manager and has been a hiring manager and studies teams and organizations, particularly in healthcare, what I would say on the individual level that's been probably successful in getting people down the road to sort of alignment around values and mission at the team level is being really careful about hiring. I think bringing people onto a team, and when you build a team or create a new team, and how you're sort of selecting people or hiring people and ensuring that there's some either value alignment or mission alignment, depending on, as a manager, where you think is more important. I think it's part of the individual alignment starts really, really early. And I also think the other piece I would say is you don't always get to pick your team. Sometimes you inherit a team and values aren't aligned. I think transparency and honesty about where people are coming from and what their values are, and where they're going. I think I've seen in some healthcare organizations, as projects come up or new initiatives come up and they're building teams for them, they have conversations, managers and leaders have conversations with individuals and asking, where's your career going? Does this align with your professional development? Does this align in what you're personally interested in, or what part of this could you get excited about? So on the individual level, I think it's about selection or hiring, and I also think it's about honest, transparent conversations that are linking the bigger picture or the new initiative to individuals in terms of values and where they're headed. I think having a team that might not be aligned with the bigger organization can sometimes be more challenging. And you know, this issue of alignment, there's a management kind of guru in the States, his name's Peter Bregman, that writes a lot about alignment, and he has a big arrow process. And I think with alignment with teams within an organization, you want everyone swimming in the same direction and focus on the same sort of big goal, and that's really important. You know, I can say at my own organization, we're a Center for Primary Care. We do 4 different things. We do research, education, we do implementation or systems transformation work as well. And I think I mentioned innovation, but we have an innovation team as well. We do those 4 different things, but all of them, how we do them is different, but they're all in the service of furthering primary care and making primary care better here in the United States. And I think part of getting the alignment on that is having the teams and the team leaders at the same table talking about the mission, the vision, and how they're contributing to that. I'll stop there because that's a rather probably long-winded answer to what you're asking, but let me know if I need to clarify anything or go deeper. Great question.
Thanks for the long but useful answer, I think, because we never have time to talk about this kind of thing. We never really have time. I mean, sometimes it sounds superfluous because of volume of work, which can be extraordinary. And sometimes it can appear to be superficial per se because we are talking with buzzwords.
Right.
So, and some other times in a governmental academic setting, you have to align government policy to academic, to particular university, core values to departmental mission, and so on and so forth. So you have 4, 5, 6 missions cascading down to a team. So yes, talking about it sounds very simplistic, but I think we don't do it. So
Great.
Thanks. Yeah,
you're welcome. And I know having the time to do those things is hard, right? In healthcare, in academia, with all the, and also in academia with all the external pressures, for whatever reason, there's always a fire to put out. So how do you carve out the time to be thoughtful and have those conversations? And it's hard to do, but I think the value and the payoff of taking 30 minutes or an hour to have those conversations is well worth it.
Yeah, thank you.
Mm-hmm.
Well, I think that was quite an answer, so and quite a discussion. So great. I don't see there are any questions, but I've seen that Lorena Dean is connected. So, and I know she's working also in her center in Charité Berlin. So maybe she wants to have any comments on this. But if not, I will also ask you something like right now. I think. One interesting question will be like, what are the biggest problems that has leadership today, actually? Because, well, you have give us how we should follow towards leadership, but what are the challenges that you have faced, or challenges that you think are important to tackle?
Shandon, do you want to answer this one first, and then I'll go?
Yeah, I think I can talk about a few points. I think the main point right now is that we don't have education and training in leadership. And considering the professionals in our curriculums in many countries, we don't have any activities on leadership. But then once we finish the school, the education curriculum, then we are expected to lead teams and work in teams, actually. So we don't know how to lead a team, how to build a team, how to motivate each other, and how to go further. And I think this is the biggest challenge in that. And the second point will be the motivating people, because I think we have path dependence, that some people tend to work still alone and they don't want to be in group practices. And in primary care, this is a big challenge because the healthcare is changing, the health of the population is changing. Today, we are talking about social determinants of health, not only talking about the acute problems, not about the infectious disease, but also more complex situations. So this requires multi-sectoral approach, multi-professional teams. And if we don't know how to motivate each other towards an objective, a vision, then I think this is a big problem. And I think we need to focus on this kind of things today and develop this kind of problems in primary care.
Yeah, and I would agree from my perspective. I think the first and foremost, the education and curriculum here at the medical school where I teach a fourth-year class called Physician as Leader. It's an elective, and the skills that I focus on around interpersonal communication and team building, I always hear from my students, I wish I had this first year. It would have been so useful when I was on the wards. So I think the first issue is, how are we filling the pipeline with leaders or starting to train leaders early? And then I think the second challenge is this issue of knowledge versus practice. I think a lot of leadership training is focused on knowledge, and I think there is sort of a knowledge gap because physicians go to medical school to be excellent physicians and clinicians and diagnosticians and care for patients, and we're not teaching them leadership skills because that's actually not primarily what we do in medical school. But we need to create some space for these skills because they're being asked to lead themselves. They're being asked to lead teams as soon as they're in residency. They're being asked to lead, clinics and health systems as they progress in their careers, but there's really no place to train them. And so there's first and foremost a knowledge gap. This isn't knowledge that they're necessarily going to school for, but then there's this practice gap. There's a gap of knowing what you should do or what you need to do and taking the leap between knowing and doing, because I do think a lot of leadership is about doing. And how do we create the space for experimentation, trying new things, new actions, new ways of behaving, and reflecting on that and getting feedback. So how do we do that either within a training program or within the context of an organization, maybe with some coaching? I think putting that knowledge into action is really powerful and really important, and probably also not something we're spending a lot of time thinking about right now in leadership training.
Okay, great. Thank you for that answer. I think it's been again quite extensive. So
I spend too much time thinking about this every day.
I see. No, but it's great because as Elena commented before, it's something that we don't take too much time sometimes in thinking, and it's really important. So, and you have put it like really clear and very step by step. I'm going to give a bit of time to see if there are some other people wanted to jump in or say some comments. But otherwise, maybe it's good if people also have your contact details. So if they have more questions or maybe they think about something later, yeah, they can see. And well, I think maybe it's also good that you remind them again that you will be coming to the European Forum for Primary Care conference at the end of the year, well, at the end of September, beginning of October, that it will take place in Nanterre, in Paris. And you will be having a half-day seminar there, so you will really get hands-on into the workshop of leadership and driving people in this. So hopefully people that are joining today's in the webinar will come to Nanterre and keep going on the conversation.
And please do add a gender element because we need a bit of that, if possible. So if there is something on, I mean, we do have some things, but if you can add an element on leadership of teams and gender for women particularly, please consider adding it because we see a lack of guidance on that too.
Can you say specifically what would be useful or what sort of situations and challenges you're facing?
I think in primary care teams, you have a couple of professions that are highly feminized. Midwives are one, nursing personnel is another one.
Mm-hmm.
This is not changing but rapidly, because hierarchically the teams are not led by a midwife or a nurse, particularly in settings in certain areas of Europe or certain remote settings. And it is very difficult to balance both in terms of, when you're discussing a primary care intervention, to be led by midwives or to be led by a young woman, a young nurse, for example. You get resistance of different kinds. So even if she's not the direct leader, you need to have some practical help on how she can change stereotypical behavior, which may have very little to do with missions or values of a particular organization. And we have used SDG 5 from the Sustainable Development Goals a little bit, but I mean, for my country, for Greece, and I think for many other settings, this is not yet very, very relevant. We are quite behind on that. So.
Thank you. That's really helpful.
Thank you.
Okay, I don't see any other questions, but maybe you have last comments or last thing that you want to say to people. I want to provide you the floor for that. And then maybe if there are not questions, we can just finish and then just follow up later, probably in Nanterre.
Sure. I mean, I would just say thank you all for taking the time to joining us. Please consider joining us in September at the EFPC conference. And also, if anyone's in the medical school teaching space and is interested in what I'm doing, I also love to learn what other people are doing. Please feel free to drop me a note. That would be my final comments. Chandan?
For me too. Thank you for all your attention and joining us today. I just want to remind you that if you have any questions about developing your values, beliefs, vision, and the team vision and the organization vision, just do not hesitate to send us a message. And our contact information is here. We can keep in contact for further organizations and activities. And hope to see you in Nanterre in September.
Yeah, and I just want to finish thanking you, because I think it has been quite relevant and quite interesting for everyone. And well, Chandan, but especially Erin, because it's really early there in Boston. So thank you for joining, both of you. And really looking forward to see you in Nanterre and continue the conversations here. And I have some comments that it has been the best lunch of June so far. So actually, I think people really like it. So thank you so much to both of you.
Thank you.
Thank you.